As prevention, majority of what happens with developing heart disease is prevented. 80% of that is prevented.
Wow.
Yes.
So how do we prevent it in ourselves? Is it exercise and what we eat?
So that's some of that. So one of the things to actually recognize is, what are you doing? How active are you? Exercise is one, so at least about 30 minutes a day, 150 minutes a week if you're able to. If you're doing really hardcore exercise, rigorous sweating, 75 minutes a week. But the things that you need to know is, do you have high blood pressure? Is that being treated? Do you have diabetes? Is that also being treated? Are you smoking? Are you willing to really stop now, because those increases the risk of heart disease? And if you have high blood pressure and diabetes, or if you don't know you have them, are you really going to a primary physician or provider practitioner to really screen yourself for those things? Here's one thing though that's almost new within the last few years or several years, is what we call the non-traditional or emerging risk factors for women. And what that is really is, if you've been pregnant before and you had high blood pressure during pregnancy, you had diabetes during pregnancy, you also had breast cancer on the left side and was treated with radiation, women who's had chemotherapy, anthracyclines, been treated, and really also women who've had pregnancy loss. All of those are emerging risk factors for heart disease. If you add that to not exercising, not eating well, that really causes big problems for women.
That's scary.
It is.
That's scary. And the fact is, you have to take control of your own life. You have to want it, because if you don't want it, you're not going to change it.
You're absolutely not, because think about this, right? We're at the bottom of our list.
Oh, absolutely.
We have our families, we have our children, and then if we're in those sandwich years, we have our parents to take care of while we take care of our kids. We have work, and most women within their prime in the 40s and 50s, they're trying to do high power work, so you have projects and things like that.
Right.
But one of the things that I really want to make sure that women know is, heart disease is not for a woman that's 65 years old.
Right.
Those emergent heart disease that I'm talking about, risk factors, can really come at an early age. You can be strike with it at the age of 45 and not even really pay attention to it, thinking that you're waiting for postmenopausal years to be able to really go and take care of yourself. That is not the case. So what I really want to get across today to a lot of women is, please start today. Take the little steps. You know, if you feel you're sitting down for a long time, you're doing nothing, get up and take a walk, you know, do an exercise. Watch where you eat, because most of us are in charge of the grocery list. So please turn it over, see how much salt is in there, because less salt really will lower your risk for heart disease, right? High blood pressure. Also, red meat, cut that, you know, more lean fat, fish and chicken and all of that, because most of those things that we do, little steps, we don't realize it. It's the things that are going to really impact our lives for the next couple of years to come, you know.
Right. Awesome. You're so awesome. Thank you so much. This information has just been incredible. And as we said, Dr. Tobb is going to be speaking at the Cone Heart Women's Health Community Event, which is happening on Friday. There's a breakfast at 7:30, then classes run from 8 until 2 on the Union Square campus on Eastgate City Boulevard in Greensboro. The event is free, but you do need to register. We can tell you more about that. The early morning classes are full, but you can still register to attend sessions after 11 o'clock. And you can do that by going to conehealth.com/communityheart.